Hi, it's Dr. Greg Jantz. As a counselor, one of the things that I'm seeing and have seen over the last 40 years is anxiety. But what I'm seeing is the great increase in anxiety. In fact, that's why I wrote the book, The Anxiety Reset. It's time to reset. But I want to talk about anxiety and stomach pain. Anxiety will always find a home in our gastrointestinal tract. Anxiety will always be felt in your stomach as just one of the places physically or physiologically you're going to feel it. Now, why does anxiety hit our gut? Here's something to remember. Number one, mind-body connection. The gut is oftentimes referred to as the second brain. Well, as the second brain, because there's a rich network of nerves, and one of those is the vagus nerve, and the vagus nerve travels up to the brain, so gut to brain. And this is why we talk in terms of the communication and relationship between this brain and our second brain, sometimes as it's referred to. Stress affecting the gut can affect the brain, affect chemical production. You've heard of serotonin, dopamine, which is primarily manufactured, in other words, made in the gut and travels to the brain. So this is why you're going to see chronic stress, anxiety. Sometimes we'll say that pit in my stomach, and that's what we're talking about. Number two, the fight or flight mechanism. When we're anxious and we feel like either fighting, facing it, or running, it is a surge of adrenaline and all the activity in the heart rate and blood pressure, because we are readying ourselves to depart or face whatever we have to face by going forward. Now, chronic situations that create that level of stress will cause the adrenals to overproduce over time this chemical called cortisol. And we don't want to we need it, but we don't need lots of it. In fact, it's something that's going to help add to inflammation in our body, and chronic stress will create inflammation, which we don't want to do. So stomach pain, fight or flight, the body's always on a hypervigilant state, or the mind-body connection, understanding the relationship between the two brains. All right, symptoms. There are number 1 and 2 here, and I made a note. They're pretty obvious. You can sometimes people say fluttery feeling. You feel that anxiousness in your gut. Bloating, I made a note, indigestion, cramps, even diarrhea. So anything in your gastrointestinal tract that seems off, that could be it. And then number 2 is emotional triggers. If there's triggers or situations that can cause these symptoms, they will worsen over time if left untreated. So emotional triggers could be past trauma, a lot of anger, hurt. You're carrying around a lot of emotional pain, that trauma buildup, and so that's going to add to it. How do we manage this? Well, quickly, breathing exercises can be helpful to help reverse some of the sensations, and there's more information in the blog on this, but I want to mention our breathing has a way and affecting the emotions. There are some things you can specifically do, some things that we actually teach with breathing that can be helpful. Be careful about what you're drinking and eating. Alcohol is a never don't do. And some of the herbal teas, just to soothe, peppermint tea, ginger tea, some of the herbal teas really can be helpful, just in alleviating, calming the stomach. So there are some things you can do. Now, if this continues, we know that this is the stomach pain is a physiological reaction, and it's also an indicator, hey, I may need to have some intervention here because I don't want other physical issues. And I know if I'm feeling it physically, I'm already feeling it emotionally. And that fear and that anxiety can really paralyze us. And this is why anxiety, being so common, different forms of anxiety, when it begins to create physical issues, and we've talked specifically stomach pain, but it may be aches and pains, headaches, dizziness, you feel like something's really off. That's an indication, hey, I need to pause, get some help, get a refocus, help my body reset, and also deal with what are those underlying issues that need attention.